This morning, parents, listen up. Changes could be coming to your child's vaccine schedule. That could be on the way. Today, a health committee will be reevaluating recommendations on multiple childhood vaccine shots. 11 Alive, Stephanie Haynock joining us live from CDC headquarters. So, Steph, we know there's been a lot of debate on whether changes have even been necessary, if they've been proven necessary. What are you learning this morning?
Yeah, Jonathan, that's right. And just yesterday on Capitol Hill, we actually heard one lawmaker expressing her concern about making these changes to the vaccination schedules and how that could impact the cost of vaccine shots and who and when they're covered for, when children will be getting those shots. Today, the committee is going to be discussing two big topics. One, not allowing children under 4 to receive a combined vaccine to prevent measles, mumps, rubella, and chickenpox. Instead, they're looking at potentially offering the MMR vaccine and the chickenpox vaccine separately. Currently, parents have the option to get either the combined vaccine or 2 separate shots. Also, this committee will be looking at delaying the hepatitis B vaccine administered to newborns, pushing potentially for the dose to be given around 4 years old instead. Studies have shown that hepatitis B vaccine is safe to give to newborns. There is no recent research suggesting otherwise right now. The advisory committee on immunization practices, that meeting is starting at 10 a.m. They're going to discuss these topics, and on Wednesday, some lawmakers expressing concern on the future of public health if these vaccine schedules are changed and the overall risk of all children. One senator speaking out, Patty Murray, saying that if vaccines are no longer recommended, they won't be covered by insurance. And then she says families won't be able to afford to cover the shots out of their own pockets. Now, on Wednesday, by testifying about her firing, former CDC Director Susan Menares was asked about her thoughts on changing vaccine recommendations and schedules for children. She says she hasn't yet seen any data backing up what RFK Jr. is pushing for.
I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety.
And today's meeting expected to go all day, Jonathan, through 5 p.m. Again, it starts at 10 a.m. And then tomorrow, the committee will be meeting again. The focus tomorrow is COVID vaccines. We know RFK Jr. has said he's no longer recommending COVID shots for healthy children and pregnant women. Live from CDC headquarters, I'm Stephanie Haynock, 11 Alive News.
All right, Steph, we know this committee, as you mentioned, will be meeting for a couple of days here in Atlanta. Any votes expected while they're here?
Yeah, so Jonathan, actually, there is a vote expected by 5 p.m. That's according to the agenda of today's committee meeting. We, of course, will be listening in once things get started at 10 a.m.
All right, Stephanie Haynock live from CDC headquarters this morning. Thank you.